Hi, doctor. Can you introduce yourself and your position?
Sure. I'm Steve Kishineff. I'm co-medical director at Providence St. Joe's Medical Center of the Emergency Department.
Okay, so I have one question for you, and that's how do you feel about interprofessionalism in healthcare?
All right. By interprofessionalism, I gather you mean working together as a team.
Correct.
And the only way that patient care can be optimized is when there's a team that is all about making sure the patient gets the right care at the right time and all the correct tests are done in the correct order. In order to do that, registration, x-ray techs, phlebotomists, nurses, and physicians need to work together as a team. It's not done in a vacuum. It's not done by one discipline. The most efficient way is when we are all working as a team. We know each other's goals, and we try to be as efficient as possible in order to get the best patient outcomes.
Okay, can you state your position?
My name is Telly Risby. I'm a physician assistant in the emergency department at Providence St. Joseph.
Okay, so my question to you is how do you feel about interprofessionalism in healthcare?
It's kind of the staple of my profession. As PAs, our job is to communicate with MDs, consult specialists. So, having that communication is kind of what my profession is about. I think when you get into more inpatient work, you have social workers, you have case workers, you have specialists, you have primary, and if you have good communication with all those groups, it leads to better outcomes for patients.
So my question to you is, do you think cultural competency and interprofessionalism is important in healthcare?
Yes. So the issue about cultural competency is how you relate to other patients. Because we're in the emergency department, we take all comers, meaning whoever walks through the door is someone that you have to relate to. In the emergency department is challenging in as much as I don't know them. I have about 10 seconds to figure out who they are and how to relate to them. And to break down barriers as well, which can be difficult in some instances, because sometimes people come in not trusting you. So in terms of cultural competency, you have to figure out their background, how to relate to them, and how to break down those barriers so that you can care for them and so that they can trust you as well. It can be difficult, but when someone comes in from, a bored rich housewife from Calabasas versus a homeless person on the street, the issue is how do you know them and how do you relate to them? And I'm not a bored housewife in Calabasas and not a homeless person, crack addict on the street yet. But my issue is sort of like, what is it that they each need and how can I provide that for them? And I think that's the issue of cultural competency.
And as far as interprofessionalism, do you think that's also important in healthcare?
I do. It's sort of how you relate to other doctors. I mean, being an ER doctor, honestly, is like being a bit of a used car salesman. If I think someone needs a urologic or gynecologic or any kind of other care, I have to tell the urologist or the gynecologist what it is that this person needs from them, and I'm the intermediary, and I have to make sure that they get the care.